Today I am tell you about left ventricular diastolic dysfunction on echocardiography. How to assess diastolic dysfunction on echocardiography. So the most important part in assessment of LV diastolic dysfunction is left atrial size. If left atrial size is elevated, that means left atrial volume index is more than 34 ml per meter square, or LA size is more than 4 centimeter in 2D image, that suggests left atrial pressure is high. Second, the another most important parameter for diastolic dysfunction is TR velocity, tricuspid regurgitation velocity. If TR velocity is more than 2.8 meter per second, simultaneously, if IVs is dilated and not collapsing with inspiration, that's suggestive of elevated right atrial pressure. So these two parameters is most important: LA size and pulmonary pressure, estimation of pulmonary pressure by tricuspid regurgitation. If LA size and TR velocity is high, then patient has grade 3 or grade 4 LV diastolic dysfunction. Patient may have grade 2 LV diastolic dysfunction. Then we have to see the diastolic parameter like E wave and A wave, and also the tissue parameter E prime specifically. So we have to see the E by E prime. If E by E prime is less than 8, that means normal LV filling pressure. If E by E dash E prime is more than 14, that suggests elevated left ventricular filling pressure. Another important parameter is capital E by capital A. If capital E by capital A is more than 2, that suggests grade 3 or grade 4 LV diastolic dysfunction. If E by A is more than 2, but tissue velocity parameter E prime is absolutely normal, that suggests patient LV diastolic dysfunction is supernormal. E by A more than 2 can be seen in normal healthy patients, normal healthy persons who have excellent uh, left ventricular diastolic function. Then between grade 1 and grade 2 is just like normal. That's why it's called pseudo-normal. It looks like normal, but it is not normal, because the tissue velocity parameters are abnormal in grade 2 LV diastolic dysfunction, that we call pseudo-normal. E by A is 0.8 to 2, and in grade 1 E wave is less than A wave and E by A is less than 0.8. In normal LV diastolic function, E by A wave is more than 0.8. Simultaneously, normal tissue velocity parameter like E prime, normal left atrial size, normal TR velocity less than 2.8 meter per second, IVC is not dilated. So these are the parameters we have to look for LV estimation of LV diastolic dysfunction. When we have to differentiate between grade 3 and grade 4. Grade 3 LV diastolic dysfunction is reversible on Valsalva maneuver. When we tell patient to perform Valsalva maneuver, the grade 3 LV diastolic dysfunction convert into grade 2 pseudo-normal pattern, and in grade 4 the restrictive filling pattern is fixed. So even by Valsalva maneuver, E by A is more than 2, simultaneously E by E dash more than 14, TR velocity more than 2.8 meter per second, and left atrial volume index is also high, LA size is high, simultaneously PA pressure is high, and IVC is dilated, and it collapses less than 50% on inspiration. So friends, please like and subscribe to my channel.